Nearly 3,000 cases of Zika in the United States, and now a pregnant woman in Montgomery County has it. How seriously are you taking this disease that could devastate your family? Well, when we come back, stay with us. We're going to take a look at the important issue around the country and right here now in Harris County and Montgomery County when it comes to Zika. Take a look. We've had a death in Harris County, and now a pregnant woman in Montgomery County has contracted the Zika virus. It's a mean virus that not only claims lives, but is cruel to the babies that survive, leaving them with birth defects in the form of an underdeveloped brain, leaving the child's head deformed. Most of the cases have occurred with pregnant women who have traveled abroad, but there are concerns a virus could spread across the country in local mosquitoes. There have been instances of local mosquito-borne Zika cases in Florida, leaving some, especially pregnant women, terrified. The symptoms remain elusive, not severe enough to send an infected person to the hospital, but long-term effects on an unborn child can be devastating. The Centers for Disease Control report there are 2,700 cases in the United States right now. The question is, are you prepared? And are you taking Zika seriously, because it could rock your world? And welcome back. Joining us now is Dr. Jerry Sims from the Center of Reproductive Medicine. Now, Dr. Sims, this is a case that I don't think most of the public is taking seriously enough. The damage that it can do to a child, an unborn child, as they're developing in the mom, and if the mom contracts Zika. How seriously should we all be taking this? Because now we know there's some cases in Florida. Those mosquitoes somehow, some way could end up here in Harris County and Montgomery County.
Well, maybe the mosquitoes won't, but the virus likely will. Well, I think you're right. Much of the public doesn't really understand the threat. However, our particular patient population is pretty aware of how serious it is, and they're very worried, and frankly, so are we.
Now, some of the symptoms that are out there wouldn't necessarily send you to the hospital immediately or to the doctor. You may think you have a cold or a flu or something. How do you know if you have this Zika virus?
This is going to be the big problem. 80% of people who have the infection don't have symptoms. So this is going to be a huge issue for us. Those people who don't have symptoms certainly could transmit the virus, could be bitten, mosquito. But we don't yet have guidelines on who we're going to be screening unless they're pregnant. And our patient population right now is not at risk for local transmission. It's not yet in our mosquito population. I'm sure it will get here. When it does, that's going to change the rules.
If there is a woman who's out there pregnant right now and she wanted to be absolutely certain she did not have this Zika virus, is there a test that they can go to for you or their primary care physician to determine if they have the virus in their system?
There are tests that can identify whether a person has been exposed. Right now it is, I think, going to be controlled by the health departments. The major laboratories do have those tests available as well. But we right now do not have universal screening recommendations. Pregnant women, we'll be screening for risk of exposure. That means travel to an area of local transmission or contact with a person who has traveled. If they develop symptoms suggesting they have infection, definitely we'll be screening them. If we identify that they have been infected, then there are certain obstetric screenings that will be recommended.
Now, we've seen the deformities with the babies that we've seen from Central America where they have been, or the mother's been affected. Why do we see that in the last 30 seconds real quick with the deformed heads?
Why do we see that?
Yes.
Well, that indicates that the virus is crossing the placenta, infecting the baby. And we have other examples of viruses capable of doing that, such as rubella, German measles, varicella, chickenpox. Those can also affect the unborn child. That's one of the unique characteristics of this particular virus. Otherwise, it's not a threatening virus. A few people have severe disease, but it's rare.
Dr. Jerry Sims from the Center for Reproductive Medicine. I want to thank you guys for coming in today, and we will stay on top of this issue. Take this virus seriously. We're leaving you with DJ Yanni here on The Factor Uncensored.